Have you ever heard about the Fellowship Support Program? This is one of the pathways to becoming a general practitioner in Australia. So if you or your loved one is hoping to be a general practitioner in Australia, I want you to listen in and understand this pathway, because it could just be the one that you need to get onto your training and hopefully become a general practitioner in Australia one day. If you are watching me for the very first time, my name is Anna, migrant doctor mom, and we share content just essentially to guide and to support anybody that's thinking about the life of being a doctor, a mom, and a migrant in Australia. So sit back and let's just quickly dive into it. So like I mentioned in my last video, there are a couple of ways that you can become a general practitioner in Australia. And by this, I generally mean becoming via GP, which is a vocationally recognized GP in Australia. And one of the big ways is the AGPT program, which I've covered in another video. And so today I'll be covering the FSP program. There is quite a lot of confusion in this space because FSP program is actually one of the newer pathways that are now being used by a lot of IMGs on their journey or on their desire to be general practitioners in Australia. So I've seen your questions about this program. Lots of them are about costing, who is eligible, what do I need to get onto the program? And that's why I am here today to answer those questions. Okay, so in general, or in summary, like in a quick run through, so obviously as an IMG, you either have been on the standard pathway or on the complement pathway. So standard pathway, like I always say, is you need to sit the AMC exams, MC1, MC2 or WBA, and then hopefully you get your general registration. And then the complement pathway, depending on the country that you're coming from, some countries are recognized. You just need to come in and do 12 months of practice in Australia, and right away you become general. Have general registration. So the reason why this is an important pathway to put across is this is a program that is self-funded, and because it's self-funded, you do not necessarily need to be a permanent resident or a citizen of Australia or a citizen of New Zealand. And this is good news, especially to those that would like to be in a program that's supported as well by the RSCGP, but also they still are waiting to become permanent residents of Australia. So who's eligible? Who's eligible to be on the pathway? So generally, if you have either general registration, you have either provisional registration with a level of supervision of 2 and above, meaning you can do a lot of things unsupported or without a lot of support, then this is a program for you. I also saw that even with limited registration, there are few, this program actually can accept people that are on limited registration. And the people that are on limited registration is essentially those people that have done AMC1, they are yet to do AMC2. So those who are on limited registration are also accepted on this pathway. And obviously they need to have level 2 supervision at least. So the application process, again, the usual important things that I've mentioned in the AGPT program is essentially you need to look out for the dates, and then you need to do the formal application, and doing the application is actually free. And then after that, once you're selected, you need to be to work in a comprehensive general practice clinic, which is in MM2 and above. So you cannot do FSP in a metro sort of environment. You will need to be in an MM2 and above, and obviously get a practice that you can work at with a supervisor. So, and the supervisor obviously will need to be RSCGP sort of accredited and things like that. So FSP, in some way, I feel has sort of replaced the independent pathway. In the past we used to have independent pathway. So in my own evaluation of this pathway, I almost feel like it has replaced the independent pathway, which is good because it allows a lot of IMGs with a bit more limitations to be able to get onto the program and hopefully become general practitioners one day. The other thing that's quite important to know is it It is divided into two, so the training and the post training period. So the training period tends to be 18 to 24 months, and during that time there are various terms that you need to cover, and the cost I felt was it's not cheap. It's not a cheap program because it's 10,000 per term, and post training. So after your 18 to 24 months, then there is the post training period is where now you're preparing for exams, and then you're submitting your paperwork so that you can get the fellowship in the end. So the only thing about it is you need to be aware there is a cost implication. Although I almost feel like the cost implications, because most of the times you can put this onto end of the year, you can put it as a tax deductible expense. And I feel like, it's one way of just getting ahead of things and getting onto a program before waiting to formally become a permanent resident. And the other thing that I've had a few of my colleagues that are on the program say is, because you're working as a contractor and you're working as an independent contractor, is you will negotiate your rates or your payment, percentages with the practice, and then obviously that gives you a little bit more income compared to those that are on the formal AGPT program. So I feel it is a pathway worth exploring, especially if you're looking at getting onto a training sooner than later. Obviously, at the end of the program, then you need to prepare for the exams. The thing that I noticed about this program compared to the independent, what used to be the independent pathway, is it is supported by the college. By that I mean you will be small group discussions, you have access to your supervisor, you get a bit more support compared to those days when you would do most of the preparation by yourself, and you would have to prepare and sit for the exams by yourself, obviously. So at the end of the training, at the end of that period when the college thinks you are eligible to sit the exams, then obviously you'll apply for the exams like any other candidate or any other registrar, and by that is you will apply to the RSCGP to sit the AKT KFP, and if you pass that, then again you will apply for CCE, and hopefully by that, once you finish the exam components, then you will put in your final paperwork to become a general practitioner in Australia. So in summary, that's what FSP program is. And if it's a program that you are on and you would like to add a few little, you would like to add a comment on how it's going for you, how you're finding it, whether it is supported or not, because I have not done this program. I did AGPT. So if you have benefited from this program, please put a comment down there so we can assist someone. If you are already on the training and you have a bit of pointers to what people can do to get onto the program, whether it's beneficial, whether it's helping you, then definitely comment as well. Let's try and support our colleagues that do not have the information so they can get onto the other side and become general practitioners. We need GPs, and obviously it's always a joy when you can lend a hand where it's needed. Thank you so much for watching, and I hope this is helpful.